to 8 p.m. last night, we're reporting 7 new local cases. 3 of the 7 local cases are known contacts of previously reported cases and were potentially infectious in the community. The 4 other local cases are currently not linked directly to any previous cases. However, that remains under investigation by our contact tracing teams. We believe there could be a link, but we're not certain at this point. I will add that of the 4 cases, 3 are from one household. They're all in self-quarantine now, and public health will continue to monitor them. Contact tracers are now working with these cases to determine potential exposure sites for the cases that have been potentially infectious in the community over the last few days, and these will be uploaded to the Healthy WA and wa.gov.au websites when confirmed. The genome sequencing for the mystery case reported on Wednesday for one of the cases reported has not provided an exact link to the Coburn cluster. This means public health are now potentially managing multiple different clusters in addition to the Coburn cluster. We're currently monitoring them closely as we continue to interview and determine where they potentially have contracted the virus. Hopefully they can be linked to one cluster, but right now it is too early to tell. We're also reporting 3 travel-related cases up till 8 p.m. last night, 2 from overseas and 1 from interstate, and all are in hotel quarantine. These total 10 cases in the overnight reporting cycle take WA's total to 1,348 cases. We currently have 82 active cases. Of these, 24 are in hotel quarantine, 58 are in self-quarantine, no one is in hospital. To date, we have had 151 Omicron cases in WA. As more genome sequencing is undertaken, it will identify any further links or variants. With these additional cases, and as some remain unlinked, we need people to get tested. I cannot stress this enough. There is potentially a missing link out there. Please come forward and get tested if you feel unwell, if you have symptoms, if you have been to exposure sites that require it. Yesterday, we undertook 4,222 tests across public and private clinics. These testing numbers are not high enough. The higher the testing numbers, the more confidence we have in ensuring positive cases are accounted for and are in quarantine. This and vaccination is the only way to limit the spread. We need to get as many people as possible tested. Please, continue to check exposure sites regularly, monitor your health, and if you feel ill, stay home, get tested and quarantine. There are currently 5,147 Australians in hospital today with COVID. Fortunately, none of those people are in Western Australia. There are 424 Australians in intensive care with COVID. Thankfully, none of those people are in Western Australia. And sadly today, Australia has reported 88 deaths across the country, including 46 in New South Wales alone. This is absolutely devastating news for so many families across the country. Our thoughts are with them. It's a heartbreaking time. For some perspective, Omicron is dangerous and it's serious. We need to take every precaution we can, and we know that 3rd dose vaccination is key to all of this. Our first dose rate now sits at 96.4% of over 12s. Our second dose rate is 89% of over 12s. And 3rd doses are now at 27.2% based on the 16 plus rate. It's pleasing to note in the space of just 4 weeks over the holiday period, our 3rd dose rate has climbed from 4.5% to now being 27.2%. And it continues to climb every day. We need to keep this momentum up. All the science and health advice points to vaccination being the best protection against COVID-19. In particular, 3rd doses bolster people's protection against Omicron. 3rd doses also significantly reduce the level of transmission of Omicron. So with our current Omicron outbreak lingering, it is now more important than ever to get vaccinated. Now, in light of the current outbreak we're dealing with, we have received new health advice to help prevent the transmission of Omicron at particular events. Australia Day is only 4 days away. We want all events to be able to proceed safely. So therefore, for all public events on Australia Day, mask wearing will be required for both indoors and outdoors. This is a safe and smart precaution to help minimise the risk. I'll now hand over to the Health Minister before taking your questions. Thank you.